Hello, my name is Chantrian Harris, and I am your instructor for today. I will be giving you guys a lecture on modifiers. When a procedure code description needs to be altered a little, that is when we use modifiers. Modifier 22, increase procedural services. When this modifier is used, it is only used when the physician is doing more than what he would usually do during a procedure. And you guys have to make sure that you submit documentation proving that this modifier was necessary, because the physician will get paid 20 to 30% more than he would usually get paid for this procedure, because you're submitting this procedure code with a modifier 22. Modifier 23, unusual anesthesia. This modifier is used when anesthesia is performed by anesthesiologists during a time anesthesia is usually not required. An example of that would be a patient that is senile having a procedure done that usually does not require anesthesia, but in this case it does, because this patient may not be able to stay still or keep calm during that procedure. So an anesthesiologist would need to give this patient anesthesia during this procedure. This is an unusual situation that anesthesia would be used, and that's why you would need to use that modifier 23. A written report would be required. Modifier 24, unrelated E&M service by same physician or other qualified healthcare professional during a postoperative global period. This modifier can only be used on E&M services and on ophthalmological service codes 92002 to 92014. An example of when you would use this modifier is a patient comes in, the patient has an upper respiratory infection, and it's during the global period of a patient that recently had a total knee replacement for osteoarthritis. The upper respiratory infection has nothing to do with the osteoarthritis, so therefore the physician can bill for that evaluation and management service and add that modifier 24 to it. Modifier 25, significant separately identifiable E&M by the same physician or other qualified healthcare professional in same day of procedure or other service. This modifier is used when evaluation and management is performed with a surgery that is not related to the evaluation and management service on the same day. For an example, a patient comes in and they're diagnosed with sinusitis. The physician noticed that the patient has a lesion on the arm. The physician decides to excise that lesion. You would code the evaluation and management code with the modifier 25, and you would code the procedure code separately. Just make sure you have two separate diagnoses matching up with each individual service to prove medical necessity. Modifier 26, professional component. This modifier is only used with procedures that have a technical component and a professional component. The professional component is going to represent the physician. The technical component is going to represent the technician and the facility and the equipment and so forth. It is going to be very important for you guys to choose the correct modifier, because it will affect reimbursement. So you want to make sure your physician or you want to make sure your facility is getting paid the right amount. So make sure you do not get the two modifiers confused. Modifier 32, mandated services. This modifier is used when a third-party payer, such as an insurance company, requests a second opinion evaluation. An example of when this would happen is if a patient is seen by a physician for an evaluation because a workman's comp insurance company requested for this patient to come in and to be seen for a second opinion to evaluate a disability. Modifier 47, anesthesia by surgeon. This modifier is used when the surgeon administers anesthesia during surgery. The physician, which is the surgeon, is compensated for the time spent administering the anesthesia, but he is not paid as if he is an actual anesthesiologist. The anesthesiologist is paid for preparing, monitoring, and evaluating the patient as well. Modifier 50, bilateral procedures. This modifier is used when a procedure is performed on the right and left side of the body. For example, a patient comes in and the patient have a hip replacement performed on the left side and a hip replacement performed on the right side. You would use modifier 50 instead of left, which is LT, and an RT modifier. Modifier 51, multiple procedures, can be used when more than one procedure is performed during one operative session. And that can be even if the procedure is performed more than one time. So for example, a patient has an excision of skin lesions, but they have multiple excision of skin lesions. You can code for each one. And on the second code, third code, fourth code, and so forth, you can add that modifier 51. Modifier 51 cannot be added on the first procedure ever. So do not use modifier 51 on the first procedure. Let's talk about how this affects payment. Medicare will pay 100% for the first procedure. The second procedure through the fifth procedure will be paid at 50%. And then more than that will be priced manually. Now, I want you guys to also know that other insurance companies may do this a little differently. Again, that's just Medicare. In some instances, the insurance companies will pay the first procedure at 100%, the second procedure at 50%, the third procedure at 25%. And that's why it's going to be very important to make sure that you guys choose the correct principal procedure. Your first procedure should be the most complex procedure that's being performed during that operative session because it's going to be paid at 100%. Modifier 52, reduced services. This modifier is used on codes when the service is reduced from what is described in the CPT book. The physician's documentation has to state that the service was discontinued after the surgery was started. Or it may be as simple as a procedure that's considered to be a bilateral procedure was performed unilaterally. You're going to submit documentation to the insurance company to make sure the insurance company have an understanding of why this modifier is being used. Modifier 53, discontinued procedures. This is to be used when the physician starts a procedure, anesthesia is given to the patient, but the physician decides to terminate the procedure because of the fact the patient is having some type of complication during the surgery. An example of that would be arrhythmia or breathing problems that's causing the physician to be concerned to proceed with the procedure. So you guys may be wondering, what is the difference between Modifier 53, discontinued procedures, and Modifier 52, reduced procedures? The difference between the two is, with Modifier 52, reduced procedures, the reason the procedure is reduced is because the physician decides that the procedure needs to be terminated, not because of the fact that the patient is having a complication, but because of the findings during the procedure. So there's no complication there that the patient's having with the Modifier 52. Modifier 53 is used when the physician is concerned about the patient's health and decides to cancel the procedure after anesthesia is given to the patient. Modifier 54, surgical care only. This modifier is used in conjunction with Modifier 55, which is postoperative care only, and Modifier 56, which is preoperative care only. These modifiers are required when there are different physicians providing different parts of a patient's care. A transfer order is required by each physician when performing each individual part of this patient's care. Modifier 54 is to be used for the intraoperative part of the care, which is also known as the surgical care only. Modifier 55, postoperative management only. This modifier is used by the physician that only provides postoperative care for a patient once they're discharged from the hospital from having a procedure. The documentation for this transfer of care is required to be in the patient's medical record. Modifier 56 is to be used for preoperative management only, which means the physician only provides preoperative care. Please take note that Medicare does not accept this modifier. Medicare considers preoperative care to be part of the surgery. Modifier 57, decision for surgery. This modifier is only used with evaluation and management codes 99201, 299499, and with medicine codes 92012 to 92014, which are ophthalmological services. The purpose of this modifier is to indicate when the decision for surgery is made. So if the physician is performing an evaluation and management service or an ophthalmological service, you would add this modifier if the physician decided to perform surgery on that patient during that visit. Medicare has a specific guideline for this modifier. If you're coding for Medicare, you can only use this modifier on the day of surgery or the day before surgery. Modifier 58, stage-related procedure service by same physician or other qualified healthcare professional during postoperative period. What that means is a procedure took place, and in addition to the procedure that took place, another procedure is either planned or a related procedure is done after that first procedure. You will add that modifier 58 on those procedures to let the insurance company know that this is the start of a new global period. Every time a new procedure takes place that's related to that first procedure, the global period will start over. Modifier 59, distinct procedural services. This particular modifier is used when a procedure is coded in addition to a primary procedure, and the secondary procedure is usually considered to be related to that primary procedure, but in this case, this procedure needs to be coded separately and paid for separately. So it's unbundled, but it should be paid for. One example of when you would use this modifier is if a patient has an excisional lesion on one leg and multiple sites. So the patient can have like 3 different lesions, and you're going to bill individually for each lesion on the leg. So on the first one, you will code, whatever that particular procedure is, and then the additional ones, you're going to put that 59, letting the insurance company know that I'm not billing this by mistake. I'm billing this on purpose. I didn't make a mistake and just put this procedure down 3 times, and I need these procedures to be paid individually. Modifier 62, 2 surgeons. This modifier is used when 2 surgeons perform an operation and they act as co-surgeons and they perform equal functions during the procedure. When 2 surgeons are required, it usually is surgeons from different specialties. Each of those surgeons perform specific parts of the surgery that is related to their specialty. Each surgeon will code the same procedure code using the modifier 62. and each surgeon must do a separate report dictating his or her part of the procedure. When two surgeons perform a procedure, the reimbursement for that procedure from the insurance company or by the insurance company is at 125% instead of at 100%. This will cover the cost of two surgeons. Modifier 63, procedures performed on infants less than 4 kilograms. When a procedure is performed on an infant that weighs less than 4 kilograms, the procedure becomes more difficult, so it is necessary to add this modifier. It is acceptable to use this modifier with all codes in the surgery section except for the integumentary section. Modifier 66, surgical team. This modifier is used when complex procedures take place, and when complex procedures take place, sometimes there are more than 2 surgeons required to complete that surgery, and each one of those surgeons are going to perform usually their specialty during the procedure. Modifier 76, repeat procedure service by same physician or other qualified healthcare professional. This modifier is used when a patient comes in and the procedure is done more than once on the same patient of the same location. This modifier is used when it is medically necessary. And an example of when that would be medically necessary is if a patient comes in and they receive an x-ray before a repair of a fracture and after a repair of a fracture. And this lets the insurance company know that this is not a duplicate charge. This procedure is intentionally billed twice. Modifier 77, repeat procedure service by another physician or other qualified healthcare professional. This modifier is very similar to modifier 76. The main difference is that with modifier 77, this is not the physician who performed the first procedure. This is a different physician. That's the main difference. The procedure must be performed on the same day. A written report is required to be submitted to the insurance company to prove medical necessity. Modifier 78, unplanned, return to operating procedure room, same physician following initial procedure for a related procedure during postoperative period. This procedure is performed because a patient is having a postoperative complication and the patient will need to return to the operating room. When you're coding for that procedure, you need to add that modifier 78. When modifier 78 is used, this does not affect the global period. It does not start over. And this modifier lets the insurance company know that you are intentionally billing or intentionally coding for a procedure during the global period. But the reason why you're coding for this procedure during the global period is because of the fact that the patient had a complication. So a modifier 78 is required. Using modifier 78 will allow for this procedure to be paid during the global period. In most cases, anything related to a procedure during the global period is not paid separately, but because this is a complication, the physician may be paid for this procedure. So don't forget that modifier 78. Modifier 79, unrelated procedure or service by same physician or other qualified healthcare professional during postoperative period. This modifier is to be used when a patient comes back for a surgery that's during the global period of another surgery that's not related to that first surgery. One way of knowing that this procedure is not related to the first surgery is that the patient will have 2 different diagnoses. So just make sure the diagnoses are different. If you're coding for the E&M and it's the evaluation and management service during a postoperative period, you're going to use modifier 24. And I do want you guys to know that when you're coding, when using modifier 79, the global period starts over for that procedure. Modifier 82, assistant surgeon, is used by teaching hospitals. This modifier is used when a resident assists with surgery for educational purposes. The assistant surgeon will not get paid any additional money for this. Okay, and Medicare does not allow this modifier. Do not use this modifier on Medicare claims. And if this modifier is used, you must have documentation stating that there was not a resident that was qualified to assist with the surgery. Modifier 90, reference outside laboratory. This modifier is used when the physician has a relationship with an outside laboratory. And what happens is the physicians will bill for the laboratory services, and then the insurance company will pay the physician, and then the physician will pay the lab for their services. Modifier 91, repeat clinical diagnostic laboratory test, is used when a laboratory test is repeated on the same day. You will not use this modifier on tests for confirmation. Sometimes there may be a test done and then another test done to follow that test just for confirmation that the first test was accurate. That is not the scenario when using this modifier. This modifier is to be used, again, only if the same test is repeated more than once because it's medically necessary. Modifier 92, alternative laboratory platform testing, is done when a kit or a transportable instrument is used for testing. An example of this would be code 86701, which is an HIV test kit. Modifier 99, multiple modifiers, is used when the service that was performed requires more than one modifier, but the particular insurance company or payer does not accept more than one modifier for each code. This concludes my presentation on modifiers. If you have any questions, please contact me at charris@learnmedicalcoding.com, or if you're interested in registering for classes, go to learnmedicalcoding.com. You can also call us at 1-855-263-3669.